Mhm.
Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy that you are able to be with us this afternoon, and we are looking forward to an interesting discussion led by our founder, Dr. Randall Maxey.
Thank you very much, Dr. Barbara David Stevens. Thank you, Dr. Walsh, Dr. Lawson, and Simon. I want to take a point of personal privilege today. In church today, we celebrated all the new graduates that were in our church. So I want to celebrate the graduation of my grandnephew, Jalen Cooper, Simon's son, graduated and got a full ride to college. I'm very proud of him. Thank you very much, Jalen. Well, let's go to the first slide. We're going to talk about kidney disease, and especially kidney disease in Black people. The title says Black men, but it's Blacks in general. So let's go to the first slide. So it says everything that Black men need to know about their kidneys, but I wanted to be sure that it has nothing to do with just Black men. Next slide. Dr. Neighbor Stevens.
Why kidney?
Are you on?
You went on mute, Dr. Neighbor Stevens.
Okay, I don't know how that happened. Why kidney health matters. Black men are at a higher risk for kidney disease, high blood pressure, and diabetes. Kidneys help control blood pressure, fluid balance, toxins, and red blood cell production. Kidney disease may progress silently for years before symptoms appear.
So the key thing here, if I can just comment, we know that when the body gets rid of toxins, there are two types of toxins the body gets rid of. There's water-soluble toxins, which the kidney gets rid of, and there's lipid or fat-soluble toxins that are gotten rid of by the liver. So the kidneys and the liver have two different functions. We also know that the kidneys also control blood pressure, not the heart. So that's something. But the kidney itself can make high blood pressure, but it also has a function, endocrine function, that it makes red blood cells. Let's go to the next slide. Is Dr. Walks on?
Yeah. Okay. What do the kidneys do? They filter waste and toxins from the blood. They control blood pressure, maintain healthy minerals and electrolytes, help make red blood cells, and support healthy bones and heart function.
So, most people don't think the kidney has anything to do with bones, but there's a gland called the thyroid gland, which is something like a bow tie in your neck. And on each of the four corners of that bow tie are four little glands called parathyroid glands. And those glands control your calcium and your magnesium, and therefore your bone health, and whether your bones are brittle or not, and whether they have osteoporosis. And people who have kidney disease sometimes have a lot of problems with their bones, so that's very important. Any other comment on that, Dr. Wilkes?
No other comments, sir.
Okay, let's go to the next slide. Here, Dr. Lawson's on.
Yes, I am. Can you hear me okay?
Yes, sir.
Okay. Who is at higher risk? Men with high blood pressure, diabetes or prediabetes, family history of kidney failure, obesity and poor diet, smoking or excessive alcohol use, and sleep apnea or heart disease.
Thank you very much. Let's go to the next slide. So, Dr. Neighbor Stevens.
So, what are some of the early warning signs? Well, if when you urinate, you create a lot of foam in the toilet bowl, that's a hint. Swelling in legs or feet, fatigue, unusual fatigue or more fatigue than you would think you would have given what you'd done that day, or weakness, frequent urination at night, high blood pressure, or dark urine or blood in your urine.
So the foam is very important. That foam means you're leaking protein. And if you're leaking protein in the urine, that means you're having problems in your brain, in your heart, your kidneys, your liver, and every place else. It's a sign. In fact, we did a book when I was a fellow called the renal retinal syndrome. So when your retinopathy starts, that means your kidneys are not very far behind. You can almost predict it between 10 and 12 years after that retinopathy starts that you have kidney problems. Let's go to the next slide. That's it works.
Symptoms that need immediate attention: chest pain or shortness of breath, severe swelling, confusion or dizziness, very low urine output, persistent nausea or vomiting, and blood in the urine. Need immediate attention.
Yeah, and that blood in the urine, it could be due to kidneys, it could be due to your prostate, or a number of other things. But if you have blood in your urine that you can see, it needs to be seen immediately. Let's go to the next slide. That's a neighbor Stevens. I'm sorry, that's a Lawson.
You said me or it's Steve?
That's a Lawson.
Okay. Understanding blood pressure. High blood pressure damages kidney blood vessels. Kidney disease can also cause high blood pressure. Target blood pressure for many patients less than 130/80. I understand the standards have changed a little bit. Take medications consistently and monitor at home.
So several important things here. If you imagine the little things called glomeruli, which control what the kidney does, it looks like a ball of yarn. They're very delicate blood vessels, but that high pressure, actually when it comes in, the afferent arterial, it damages that little ball of yarn. That damages the filtration method. It also leads the little sores that can develop from inflammation. They can have plaque on them. And that not only damages the blood vessel, but it can narrow them and increase the pressure even more. Let's go to the next slide. That's neighbor Stevens.
Diabetes and kidney disease. High blood sugar damages the kidney filters. Check your A1C regularly. Urine protein testing helps detect early damage, and new medications may help protect the kidneys and the heart.
That works.
What is protein in the urine? Protein leakage is often an early sign of kidney disease. Urine ACR testing measures albumin loss. Even small amounts may increase heart and kidney risk. Regular testing is important.
Thank you. Go ahead, Dr. Lawson, you want to take this one?
Understanding EGFR. EGFR estimates how well the kidneys filter blood. Higher numbers usually mean better kidney function. Normal is usually above 90, but age does matter. Values below 60 for 3 months may suggest chronic kidney disease.
Okay. So they used to have a problem with this where they made different EGFRs for whites versus blacks. And that was a bad thing because it underestimated when blacks really had kidney problems. So fortunately, that's been changed by most major labs. But the EGFR is one of the numbers that we want to keep in mind. That's neighbor Stevens.
The kidney-heart connection. Kidney disease increases the risk of heart attack and the thyroid is sitting on top of that word. High cholesterol, diabetes, and smoking worsen the situation, and healthy kidneys help protect the heart.
Thank you very much. Dr. Walsh?
Healthy eating for kidney protection. Reduce excess salt and processed foods. Limit sugary drinks. Increase vegetables and healthy proteins. Drink water appropriately. Avoid excessive NSAID pain medicines like ibuprofen
And aspirin.
and aspirin.
Dr. Neighbor?
Exercise and weight control. Aim for regular walking or low impact exercise. Even 20 or 30 minutes daily helps. Weight control improves blood pressure and blood sugar. Better fitness reduces kidney and heart stress.
So that weight control, one of the things I talked about yesterday is called Baby Got Back. And that relates to that talk we had last week on the gluteus. That's one of your bigger muscles on the body, and that's very important for blood sugar control.
Dr. Maxey, the large gluteus muscle is what you're talking about, not just a whole lot of excess weight that is in that area, because folks confuse the two.
You're right. Muscle, not fat. You're very right. All right. Take the next one if you would, Doctor.
I will. Medications that can help protect kidneys. ACE inhibitors and ARBs, SGLT2 inhibitors, blood pressure medications, cholesterol lowering medicines. Always discuss medications with your doctor. And can I just add, Dr. Maxey, that taking a bunch of medications doesn't mean you can ignore all the other stuff we just talked about, like exercise and eating healthy and controlling your sugary drinks and your processed foods and all of that. So,
And my comment on it, which you guys might want to comment on too. A lot of people say, I don't want to take much medicine. And they say, I'll just take a few. But sometimes it's important, like with high blood pressure, it's important to take anywhere between 2 and 4 type medications to control your pressure. Why is that? Because you want to stay below the side effect profile of those medications. So it's better to take 3 than take 1 and it's not controlled or you have bad side effects. And make sure that you take them consistently and don't stop taking them without your doctor knowing. I got a lot of patients that say, oh, I felt better, so I stopped taking it. Make sure you're following directions and make sure you get the concurrence of your provider if you're going to want to change or stop or change. Don't just do it on your own.
so Dr. Maxey, let me comment on that. I frequently tell my patients I don't believe in doctor's orders. I believe in doctor's agreements. And I think it's important for patients and practitioners, doctors, nurse practitioners, physician's assistants, whoever is prescribing, to get an agreement with the patient that they understand that the medicines are complementary if you're taking more than one medicine. And that's not only true for blood pressure medicines, that can be true for mood medicines, for medicines for depression and other kinds of things where you need to understand, the doctor and the patient need to understand that each medicine is working in concert or to complement the other medicine so that it's important. It's not just, well, I need 3 now, but if I feel better, I can cut it down to 1. That means that you as the doctor haven't gotten that agreement from your patient that they understand, and it means that you, the patient, don't really understand what it is the doctor is trying to do and what the medicines do.
Dr. Maxey, let me just second that and also note consistency. Dr. Walks mentioned too many people who's, I had a little headache last week, took my blood pressure medicine, took my kidney medicine, headache's gone. I'm gonna stop the medication.
Right.
Or Let me take it intermittently, like every other week or every other month. If I feel bad, I'll start taking again.
Yeah. So I like what you both said. I like what Dr. Walk said about the patient agreement. So I approach it just slightly different, Dr. Walk, especially on things like weight loss. And maybe this is not ethical, but I say for every 5 pounds you lose, I'll give you a nickel. And I compliment them on when they do stuff, when their blood pressure is controlled. I compliment them and do that way. But I try to, even though they may not agree or may not understand, they respond sometimes to me complimenting them on their achievement.
Yes.
Does that make sense?
It makes perfect sense. I will ask, I will tell my patients just to make it routine and ordinary. I will say, look, what I do is I ordinarily just get some baseline numbers so I can know where we are. And so I'll ask folks, give me your approximate height, give me your approximate weight, give me your blood pressure, just to get those numbers. And then I can refer back to the numbers. And we can, like you said, Dr. Maxey, if somebody is losing 5 pounds, because for two reasons. One is we do want folks to be healthier and to battle obesity. At the same time, we want folks to know I'm not trying to get you to lose 10 pounds a week. I'm not, we don't want you to starve yourself, because that typically doesn't help long term. So there are a lot of reasons to have those brief conversations with folks about what are those numbers right now.
Good point. Next side, who's next up on the rotation? I lost track.
We could all try to read it together, see how that works.
I don't think so.
Make sure we're all in harmony, huh? Of one
I
accord.
think it might be Dr. Lawson.
Dr. Lawson?
What test should Black men ask for? Blood pressure measurement, serum creatinine and EGFR, urine ACR, that is the albumin creatinine ratio, blood sugar and A1C, and cholesterol testing. And I mentioned that I was talking to some colleagues of mine who are professionals but not physicians, and one was trying to convince me that all these numbers and these measures is white people stuff. That Black folks, if we just be our natural thing and don't worry about it, that we don't have to do anything, and these numbers don't mean anything applied to African Americans. So just want to make this strong argument that this is data, and the best that we have, best data we have is that coming from our community, and we should be available to be able to get decent information about the predictive value of these numbers.
So that's also one of the reasons I put this in here is for that very thing you mentioned. For example, most men will know what kind of oil they put in their car, 10W30. They know they need high test gas. They know how much pressure to put in their tires. They know numbers. So it isn't important also to know your body's numbers, even more than the car numbers.
Not when it's not convenient.
I don't understand.
Oh, there are many reasons, and I won't even suggest that it's a simple thing, but what I have observed frequently is when you don't want to do something for whatever reason, it's a convenient excuse to say that, oh, this isn't for us, or these numbers don't mean anything. It's another excuse.
So let me first of all agree that that is true. We can make an excuse about anything, and at the same time, the kind of a comparison, Dr. Maxey, that you just made, I think is a useful one to talk with people about. To say to people that there are so many similarities between having your body work well and having your car work well. And so there are numbers that we track to make sure that our car is not going to break down on us. And we can use that same kind of thinking to track numbers about our body to make sure our body's not going to wear down on us or break down on us. I think part of the challenge is that your car is going to break down a little faster. You can't neglect changing your oil for 20 years in your car. but you can neglect checking those numbers in your body for 20 years. And I think that those kinds of comparisons that are made early, because that's when we teach folks to take care of their car. We teach them early. We don't give them a car and then teach them 50 years later that they should have changed the oil. We tend to tell our young people about maintenance. And I think to step into Dr. Neighbor Stevens' lane a little bit, we can talk to young people about maintenance for their body and about the things they need to do. So
Yeah. Dr. Maxey, I also think you make an excellent point. Too often, I hear young people say, I'm not good at numbers, or math's not my thing. And then at the same time, they'll sit there and sprout down the batting average, the shooting percentage of every pro athlete that you know of in detail.
Mm-hmm. That's true. That's true. Let's go to the next slide. That's Neighbor Stevens.
The importance of family history. Regular listeners to our program know how strongly we feel about this. Kidney disease can run in families. Some inherited risk affect Black families more often. Tell your doctor if relatives had dialysis, hypertension, or diabetes.
So what this is saying, you're more at risk if your family has a history of things, especially first-degree relatives. And this applies not only to kidney disease, but a lot of other things, including heart disease, but also especially in prostate cancer. If you have a first-degree relative, you have a high percentage, maybe above 95%, that you're at risk for that. So family history is very important, and make sure when you're a provider that you give that history. If you're a patient, you want to give that history to your doctor or provider, so they know that it's very relevant to you.
So Dr. Maxey, we can expand on this one as well. We are very interested in family history. Dr. Lawson just talked about some young people knowing batting averages and scoring averages, but we pay attention to, I wonder how tall I'm going to be because, my mom or my dad was tall. I wonder whether my hair is going to grow long or whether I'm going to go bald. We talk a lot about family history in some areas, and we just have to expand a lot of these conversations so that folks understand. Because the other side of that, Dr. Maxey, is that we don't like to tell other members of our family when we have some trouble. And a lot of stuff can run in families that can be a problem. Glaucoma is one of those things. You can wind up losing your sight because you don't want to tell anybody that you've been taking eye drops every day for the last 20 years, and then you find out somebody else in your family may have. So there are a lot of these kinds of things that we should talk more about the health challenges and the opportunities that our family members have to pay attention to their health so they don't have to walk down. We don't all have to have members of our family that are losing a toe and then a foot and then, a lower leg from diabetes. We don't have to do that. We can talk to each other.
Yeah, I want to just follow up with what Dr. Walk said, that a lot of times we say, well, we don't want to go back in the family, don't want to talk about it. But yet in casual conversation, amazing, especially if you have a family reunion, amazing detail come out that's very, very useful medically. Oh, by the way, everybody in the family that nobody lived past 30, don't know why. That family group that lived up by that plant over there. Everybody over there had breathing problems, and then recognize some of the terminology. No, nobody in our family ever had diabetes. They had sugar though. No, nobody had high blood pressure, but they had tension. So then look at the terminology that we use in terms of describing these terms that may not be medically the same, but they reflect sometimes very useful clinical information that can say something about what you can do to protect your lifestyle.
Amen.
Let's talk about mental health in families. Is that something we should be discussing in that family reunion too? and how you grieve and things that are problems of the family, as well as just kidney and heart problems. We should talk about that as well.
Absolutely. And it's very important because, again, we talk about the genetics and the environment, but the mental environment is very important, especially in terms of people being willing to take medication. Well documented that people who are depressed don't like to take medication. In fact, may not take medication. And it also has a direct relationship, long history of depression, often associated with problems like hypertension, diabetes. And we found that a lot of folks that's been through a lot of trauma and stress, just like combat veterans, many folks in our inner city areas have post-traumatic stress disorder. And that in itself is associated with a lot of general medical problems, especially if it goes through year in year and year out, and can often be addressed and help prevent these disorders if you go out and seek treatment for it. And it's also in doing this mental health part, again, the issue of how you describe it. Most people say, no, nobody in my family ever had depression, but we have some folks who stay in bed all day, doesn't want to do nothing. We don't have any mental illness in our family, but we have folks been in and out the hospital, psychiatric hospital. We don't have anybody killed themselves, but we have some folks that end up overdosing on drugs for no obvious reason. So that's these kinds of information is important in terms of looking how going forward, how we can protect our health.
And let me not let you all just dominate that point. It's also important to know what has happened to children in the family.
Yes.
Babies that have family members that have had a lot of maternal deaths, or family members that have had offspring that have congenital disorders of one type or another. It's important to know what's going on in your family.
Thank you.
Man.
Can we take the next slide, that's Amy Silver?
Okay? Protecting your kidneys every day. Take medications consistently. Well, we've been talking about that. Stay hydrated. Now, that's one that we probably could or should emphasize a little bit more. We know we're supposed to take in a certain amount of water every day. It is especially important when you're on certain types of medications for different reasons. Some make you lose fluid. Some, if you become dehydrated, the medication can become more concentrated. And going into the summer now, people who have high blood pressure, pregnant women, or I guess you're supposed to say pregnant persons, they're
Woman.
okay, I'm trying to be correct. Need to, and children and the elderly need to stay very hydrated. And I bring that up because this is May 31st. Before we know it, it'll be 100 degrees.
Let me speak on that in a minute. And there's something called insensible loss of fluid. Even without taking into account what you may urinate out or pee out, you lose through insensible loss through sweating. It may not be dripping sweating, but you're losing water. When you breathe, you lose water. So you lose almost 1.5 gallons or 1,500 cc's a day, not counting what you urinate out. So you got to replace what you lose by insensible loss, and you also have to replace what you pee out. So your intake should be those 8 to 10 glasses of water minimum, just to halfway stay even. So it's important to take in that water every day.
So Dr. Maxey, sometimes I get accused of being a little bit too graphic. But let me just make a point. Not hydrating yourself, not drinking water. You go home and try to flush the toilet without having any water going through it. Just do that. Do that for a few days. Try to flush a toilet with no water. And that's what you're doing to your body when you're trying to have your kidneys and your liver and everything else work, and you're not putting any water in there. There, I said it.
That's a good analogy. I like that.
And Dr. Maxey, let me also note that very nice agents to reduce weight loss, including stimulants and TLTP and so forth, they do tend to produce excessive urination as a way of removing the glucose. And folks sometimes just don't drink. And there have been reported cases of people becoming so dehydrated that it's led to death. And also athletes, surprisingly, because the extreme exertion, you just don't feel thirst. And so folks have died getting ready for now. It's bad. It's not, you don't see it much in baseball, but when folks are working out for upcoming training for football, that's when you see kids dying in the playgrounds and so forth. The coaches themselves just aren't as knowledgeable as they should be in terms of the need for hydration, especially for young people, and especially when they're working out for football and basketball.
That's a good point. And I want to emphasize one of the things you said about weight loss. Those weight loss drugs, the Ozempic and the Farxiga, they all work by making you pee out glucose. So that's the problem. So there's a question asked the other day about what's the problem if I'm getting up 3 or 4 times a night to pee? That's a problem. Psychologically, it's a problem because you're not getting your 8 hours of sleep. So that's a problem too. And that affects your mental health as well as your physical health. And that getting up at night can be due to bladder, can be due to prostate, or can be due to kidney. So that's something you want to make sure you get somebody to look at when it happens. Let's go to the next slide, Dr. Walks.
Hey, when to see a kidney specialist. If you've got persistent protein in the urine and EGFR below 60, difficult to control blood pressure, rapid decline in kidney function, or family history of kidney failure. And let me ask you a question, Dr. Maxey, as our resident kidney specialist. Some of those medications, the weight loss medications and what have you, they can give you some other reasons for having foamy urine if you've thrown a lot of glucose out there. Is that something that is accurate?
No, you wouldn't have foam from glucose. Foam is from the protein. That's very specific.
Okay, good to know.
Dr. Maxey, a quick question. They said persistent protein. So that means if you have one-time protein, it's okay?
No. I mean, the only reason you have protein is if you're leaking protein from your glomeruli. The other thing that can make it maybe temporarily if you have a urinary tract infection, but that's rare that you get foam from that. Foam itself means protein. That's the problem. Bubbles. Next slide. Is this who's next? That's Neighbor Stevens. Is you?
I'll go ahead. Key takeaways. Kidney disease is common but often preventable. Early testing saves lives. Blood pressure and diabetes control are essential. Black men should take kidney health seriously and get screened regularly.
So everybody should follow that, not just black men.
Dr. Maxey, just want
Yes,
to make
sir.
a point. One that's raised in the rural community, still seeing people who are dying from kidney failure. This, because it's so difficult to find a kidney specialist, still want to say that they should put that on their bucket list, identify what a kidney specialist is. Modern transportation, with telemedicine and so forth, that's no longer an excuse that we don't have a kidney specialist for 50 miles. I should never see one.
That's true. Not very many black ones. There's a dearth of black kidney doctors in the country. And there's a lot of financial motivation for keeping blacks out of training to be kidney specialists. I won't go into that now. But the other thing I want to speak about just briefly is all the misinformation that's being put out. And I'm encouraging people to make sure when you do research on your medical condition that you not use tic-tac-toe or whatever that thing is, but use evidence-based stuff, library medicine. Until recently, you could look at what the CDC put out. But it's important not to just listen to your friend or neighbor, they did this. Get good information, not listen to stuff that Robert Kennedy and that group was saying. Get trusted information. Any comments on that, ladies and gentlemen?
Just want to say that many of us like to use social media as our primary source of information. Check out the source. Check out the source. There's a lot of good information. There's a lot of atrocious information. There's and right now there's some stuff that's going on on one of the shows that's talking about how why you should not go to a doctor to get lab tests and all these tests and things. So again, check out the source. It sounds authoritative. Some of these programs have wonderful visuals, but it may be complete bonkers in terms of the information.
So I got a question I want to ask specifically to Dr. Walks and Dr. Lawson. What was the tentative diagnosis of a person who had run into a bear on the road, kill him and put him in his trunk, wrestle snakes, eat worms that get in their brain, and other stuff? What's wrong with that person?
Full disclosure, and I'm sure I was reminded of this actually by one of my colleagues. I plead guilty. I marched with him about a decade ago. We were fighting to increase the restrictions on marijuana. We were talking about RFK Jr. Well, I guess what it shows is that you can have incredible aberrant behavior and abnormalities and still get put in significant positions in our country. It shows that democracy, mental disorders, and other problems are not barriers towards becoming successful. And I also had to use my user disclaimer. I cannot diagnose the individual because of the Goldwater rule. But I will say that I have concerns from some of the elected officials. And there's probably several excellent books about how people with mental disorders end up in very powerful positions. And hopefully they have other skills that can offset that.
So Dr. Maxey, my response would be that, because I'm sure you're talking generally and not just about one specific person. So I would say generally, when you see someone with a lot of high risk behavior, you may have somebody that has a personality disorder in conjunction with whatever else is going on as they're responding to their environment. But the bottom line is, it sounds like a lot of high risk behavior, and people who do a lot of high risk things and demonstrate that their judgment is not the same as my judgment, I tend to not follow that person, because they may lead me down a dark alleyway, and I'm not trying to get myself in trouble. I'm not trying to wrestle bears and eat, the parasites and all that kind of stuff. So I think that the bottom line is we should pay attention to what people do and use that as an opportunity to not follow them when we feel that that their judgment is impaired. I don't know what their diagnosis is. I just know I'm not doing what they do.
Very good. Dr. Neighbor Stevens, as a pediatrician, have any comment on that?
Well, I think we are exposing our young people who may have yet to, excuse me, develop a strong executive function to all kinds of nonsense. And I was sitting here thinking as y'all were talking that it's not just social media. It looks like everybody in this world is writing a book. And I keep thinking, every time I hear about somebody else having written a book, just like I question what is their basis of authority and knowledge base when they do all of these podcasts and what have you on social media. Also makes me wonder about all of the books that are being written. And the other thought I had was in relation to uh, people's actions and opinions and following them is I still go back to COVID. I don't think there's any better demonstration of how people do not use good judgment or they don't use it or they don't have it or both when it comes to using what they have heard or seen or read. I mean, I to this day, I'm still not understanding the magnitude of the numbers of people who bought into some of the most unscientific, let me just put it that way, theories and practices that were put out there during COVID.
Okay. Any questions, comments in the chat?
No questions.
No comments?
So I have a comment, Dr. Maxey. A lot of times when we look at people who are reading things or watching things online, and you mentioned tic-tac-toe. I think that by the time we complete this particular episode, there may be 3 or 4 other social media outlets, but there are a lot of them. Some of them are very popular. We know the names, and some of them are not. And I think that people tend to look for easy stuff, right? We want, and it's easy. If I read something that tells me that all I got to do is just take this pill, and and I can do whatever else I want. I can eat, I can eat 2 or 3 fat burgers a day with fries. I can drink only the kind of soda I like. And then when we go to many of our communities and we see that what is for sale, what's available to us is not that healthy food that you talk about, where the only breakfast I can afford because it doesn't cost as much is, a grape soda and some chips. It is really, really challenging sometimes when we look at what's available and it's easier. I'm just trying to feed my family, and all I can afford is this highly processed food. But when I feed them that highly processed food, they're not hungry. And I think that is a reality, and we have to be aware that it's not all that the good stuff isn't always available, especially in many of the communities where we have these higher levels of concern.
Thank you very much. Why don't we go to final comments? Dr. Lawson?
Full disclosure, just want to encourage folks. You mentioned the point about publishing. Thanks to Amazon, a lot of us who normally would not have published are now published. I'm on my 3rd book. Get a chance to look at Beyond the Pandemic, which makes the point that the pandemic exposed all kinds of problems that exist in our community that we had ignored. The good news is that, again, some of us are now being recognizing it. The bad news is that these problems do exist. And one of the problems is that we still have a lot of misconceptions about diet, nutrition, and who is making the most sense in terms of providing information. We have a ton of information that really being given to our communities, and unfortunately, we do not have the availability of providers when we have the right information to be able to do something about the concerns that we have. Again, chronic disease is a problem that many of us recognize, and the good news is can often these disorders can be prevented or at least ameliorated. The bad news is that there's a lot of financial as well as structural reasons why these problems continue to exist.
Thank you, Dr. Walks.
Yeah, Dr. Maxey, I this what we do with Black Health Trust is, I think, very important. And I think that the earlier we can get information to folks, it's like anything else. If I can keep it from breaking, it's way easier than fixing it. And that's true for almost every part of our lives. If we can do some preventive maintenance, if we can get information to people in a way that they can use it, I think that we can maybe get to be ahead of the game. We wind with all that we do, we wind up still with higher infant mortality and a shorter lifespan. And we have a shorter term of healthy, productive life in addition to or as part of that shorter lifespan. So the opportunity is there for us to share this information and then lead by example. If I have one more doctor who is smoking a pack a day tell me that cigarette smoking is bad, I'm just I don't know what I'm going to do. But we have to lead by example. All of us who are practitioners, we just got to do better. Come on, y'all. We got to do better.
Thank you very much. Dr. Neighbor Stevens?
So I'm going to take my time here and change subjects because it's something that I want to make sure people are aware of. So, there's been all of this stuff on the news about the hantavirus, and there's
Mm.
been all this stuff, and rightfully so, on the news about what's going on with Ebola. But what isn't getting nearly the time devoted to it is that we're having a rising density of norovirus, and it has been identified to be, or it has been stated that because they're doing the wastewater monitoring, we talked about that during COVID, and the density of this is getting so high that they are predicting that we may have a very significant norovirus uh, incidence this summer. So bringing it up because in the summer people like to travel, but you don't even have to travel to get norovirus if it's in your community. And it is a virus that you need to use. You can't just assume that your hand wipes are going to get rid of it. It's really one of these bugs that you need to use soap and water. And I would encourage everyone to not get lazy during the lazy days of summer about your personal hygiene and protecting yourself.
Good point. Good point. And for my final comments, I want to remind people we're going to have a special Black Health Trust on Tuesday at 7 o'clock Pacific, which is 10 o'clock Eastern, 9 o'clock Central. We're going to be doing it live at Greater Zion Church, and I'm hoping our co-hosts can join it. I know it's late, and we're going to broadcast. We're going to be talking about hypertension and cardiovascular disease. Dr. Richard Williams and myself will be the primary speakers. Now, we have a list of questions that I've sent to my co-moderators that will allow them to adequately ask the question that we want. Thanks, everybody. Simon, congratulations on your graduation you got to go to. Have a great Sunday. Good night, everybody.
Congratulations, Simon. Take care.